Welcome everyone to another Canada Life public webinar. Our topic today is addiction, mental illness and work, how to manage it and advocate for support. As always, I'd like to start with a land acknowledgement. Although we are joined by people from across Canada today, we are hosting this event from Toronto, which is situated on the territories of the Mississaugas of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat nations. We acknowledge the Dish with One Spoon Covenant, a treaty whose spirit is one based in collective stewardship and sharing of land and resources, and one which extends to all nations living in present-day Toronto. Canada Life acknowledges the harms of the past, and we respect the history, people, and land in the areas we live and operate. We're committed to building relationships and moving forward in the spirit of truth and reconciliation, guided by shared principles of respect, equality, and collaboration. The Canadian Mental Health Association has deemed this week, May 6th to 12th, as Mental Health Week in Canada. So each year around this time, we host a mental health related webinar. And in a moment, our speakers will be introduced, but first I'd like to mention that you can ask questions if you'd like. Depending on what sort of device you've joined us on, you can either submit questions directly on the screen. The box will appear either at the side of your screen or underneath, or you can go to slido.com and enter the hashtag CLWellbeing in the field that says enter code here. We have a team of moderators who will review and publish the questions as they come up, so keep an eye on Slido, and you can give a question a thumbs up if you're interested in it, and that will help us prioritize the questions in the time we have remaining towards the end of today's event. As always, we are joined by Marianne Baton, Director of Collaboration and Strategy, Workplace Strategies for Mental Health, and she's going to introduce our guests today. We've also compiled a list of resources that we're likely to refer to during today's session, and if you'd like to see them, you can click on the resources link at the bottom of your screen. So now I'd like to pass it over to Marianne to proceed with the rest of today's discussion.
Thanks a lot, Laura. There's so much to say about our speakers today, but because I don't have enough time, I'll just give you a quick overview. So Bart Campbell has over 25 years of leadership experience in operations management and management consultant. He does have experience with implementing major performance improvement and change management programs. During this part of Bart's career, he also experienced mental illness. He's now a passionate peer support worker, a certified advanced level RAP facilitator, and I had the pleasure of learning from Bart when he graciously took part in our mental health awareness video series and shared his story and strategies. And I know you're going to learn a lot from Bart today. Robyn Priest is known as the peer support guru and has been developing mental health and peer support services for over 20 years and in at least 10 different countries. Robyn's the co-founder of Live Your Truth and is a sought-after public speaker. Their online bio refers to a straight-shooting Aussie known to be a nonconformist, and as a friend, I cannot disagree with that description. Dr. Ray Baker is a medical doctor in the field of addiction and recovery medicine. In 2022, he won a Lifetime Achievement Award by the Canadian Society of Addiction Medicine. He's a researcher, author, organizational consultant, medical educator. But here's the truth. Even with all those achievements, what distinguishes Dr. Baker is his unique approach and compassion for those he serves. He literally wrote the book on recovering coaching to support others, to provide the hope that comes from what he calls the remarkably positive recovery outcomes that he's already witnessed. And I can't wait to learn more about this from Ray today. So let's get started. Our first question, and Bart, I'm going to direct this at you first, is what are some of the early warning signs that someone might be dealing with mental illness or addiction?
Thank you, Marianne, and thanks to the organizers and everyone that's put this together. It really warms my heart to continue to be able to pay it forward. So in order for me to respond to that question, I want to draw from my RAP experience and give a quick definition of what we consider to be early warning signs. So they are subtle, internal signs indicating some discomfort that we might want to change. So, from a personal perspective, it's important that I know myself, know what I'm like when I'm well. So, when that shift happens, I'm able to recognize what's going on with me. If you're observing someone else in terms of their early warning sign, you might observe some change in their moods, some changes in their behavior, or even their regular pattern. They're not the same anymore. And sometimes with friends, we would ask them, did you wake up on the wrong side of the bed this morning? Because something's off with you. So early warning signs are observed in behaviors or observed personally because they're internal and they cause a little bit of a discomfort.
That
Thank you.
part, because it's not anything big. If we care about people, we're looking for the subtle changes, not really different behaviors. Robyn, do you have anything to add to that?
Look, I just want to say I think Bart was excellent in talking about it's about knowing ourselves. And like, I can't really say what's an early warning sign because it can look different for everyone based on who they are, how they show up normally, what it looks like. So, as Bart said, it's that piece about, does something feel a bit off? Does it feel a bit not quite the same as it normally is? And I love that piece. Hey, did you wake up on the wrong side of the bed this morning if you know someone will? Because as a friend or colleague, you're like, it just seems a bit different. So let me check that out. So that's all I've got.
Great, thanks. Ray, anything else?
In the workplace, I so often hear from employers when it comes to addiction is because of the stereotype, the negative stigma. They'll say, "Well, no, I can't understand what's going on because she's one of my most productive employees." And with addiction, that's often the case. They're at the top of the productivity because they've been overcompensating for quite a while. So that's an external sign that's often paradoxical.
Yeah, and yet we need to see it before they crash and burn, right? Yeah. All right. Second question, and this time, Robyn, we're going to start with you. How does someone start a conversation if they feel somebody might be struggling, but they don't want to violate privacy, they don't want to cross a boundary? And I guess this question really comes from maybe it's just a coworker or somebody that you don't know well that you can't say what side of the bed did you get out of. How do we deal with that?
Look, like for me, it's about relationships. So depending on like how close you are to that person as a colleague in the workplace, like if you know someone well, you can have that. Hey, did you wake up on the wrong side? But if you're not as close, I think it's just being human, right? And when we're human, we connect and say, hey, I've noticed that you don't look as happy, or things seem like maybe they're stressing you a little. I don't know if that's the case, but if it is, I'm here for you to chat to. Like, it's that, like for me, it's just being authentic and real. And if you have a concern, like how you say it without judgment. Like you're not going to say to someone, oh, you look like you're a bit crazy today. What's happening? But it's just that place. I've noticed things are a little different. Are you okay? Do you want to chat? That's simple.
Yeah. Just to name what you just did, Robyn, you said it with openness, curiosity, and caring rather than making a statement about somebody's behavior. Yeah. Ray, what would you add to that?
Nailed it. It's stay on my own side of the boundary. So I can, first of all, I want to connect with care, curiosity, concern, and express my, well, first of all, connect, and then express my concern and my caring for you, but simply stay to my own my own stuff. And an interesting factoid, a recent survey in the last 3-4 months that was just published showed that workers are most comfortable talking about their issue. If they're going to come out and talk about it, it's number one to a person who identifies as in recovery, but secondly to their immediate supervisor.
Interesting. Yeah, as opposed to a coworker or HR. Yeah, interesting. Bart, what would you add to this one?
Wow, what do I add to what was already so beautifully well put, except possibly just adding sort of like a method or a method to go about it. And so for me, I always promote, especially with people that you're not familiar with, using I statements. So ensuring that you say, well, Robyn and both Ray gave some beautiful examples. So I don't need to repeat those, but use I statements when you're addressing something. And if you have a personal story or something that you can relate to that you can throw in there to kind of connect with that person and be empathetic, then that would be great in allowing them to open up and feel safe enough to share what they're feeling and experiencing.
Which really just reconfirms what Ray said, that if you're somebody who is in recovery, you have a better in because you can relate at that level. The next question, Ray, I'm going to go to you first, is the question about, and I think the question is, should you be doing it at all? But what should I be recommending or referring someone to if they're dealing with a mental illness and addiction? Now, let's just assume they're asking for help rather than us thinking we're going to give it to them whether they want it or not. But yeah, what would you say, Ray?
Okay, we'll start there. That if a person reaches out and says help, the answer depends entirely on available resources and whether or not your workplace has begun the recovery ready transformation to become supportive of the recovery process for mental health and addiction. But the thing that people need, they don't know what's wrong with them, or if anything, and you certainly as a peer or supervisor don't know what's wrong with them. So you're not about to send them to a specific treatment, I would hope. But what they really need is a professional who can offer assessment and referral or a service so that they can help them sort out what's going on, because one size doesn't fit all. There are many options, there are many streams for assessment, stabilization, treatment, and then recovery is a whole different journey. So the assessment, I think, in my perspective, is the key piece here. And a good employee and family assistance program is a good starting point if they're knowledgeable about both mental health and addiction. But we'll talk a little bit more about that in the recovery ready workplace piece.
Okay. So you're talking about the EAP would be one place to ask, could I have an assessment? If you don't have an EAP, what's your first stop to try and find an assessment?
Well, if your workplace has occupational health provision, it's a health issue. If they offer psychological services, if you have a good health insurance plan, and otherwise a good primary care physician, whoever the employee has available to them, the message is we care, get help, and start off by working with somebody to decide what the issues are. And that can be a variety of different mental health, substance use disorder, or general health providers.
Yeah. So going to your family doctor and saying, I'd like to have an assessment to see what could be done.
And it could be that your family physician could actually do a fair bit of that. And now with our undergraduate training, they can do the initial screening for both the mental health and addiction side and help them sort out where to next. The problem with our system of care is it's siloed. and it's hard to determine which door to go to. And that's why you need a generic or a general assessor to help make those initial decisions, who then can get you through the right door to do further sorting and treatment planning.
Great. Thank you. And Bart, what would you add to that? So recommending or referring someone in the very beginning when you see them.
Well, for
Reaching
me,
out.
it's all about awesome. For me, it's all about empowering and building up the individual to feel like they're the king of their own castle, regardless of what they're feeling. So I would often tell people that they need a supporting cast. And Ray already touched on some of the people that could be part of that supporting cast, starting with your doctor, friends, family. So you need a group of supporters. And for the folks that are, and kind of loners and thinking, no, I can't do this. I forgive the religious reference, but I often say, well, Jesus had 12 disciples. Who are we to want to feel like we can do this all by ourselves? So we can benefit from having some supporters. Now, once you know what's going on with you, and now you're getting the proper professional support. I say now you can tap into what I call peer support. Well, not me calling it peer support. Robyn's been doing it forever, and a lot of trailblazers that have gone ahead of us. But you can get now peer supporters who can help guide you. These are people with lived experience. They've been there, done that. And it doesn't have to be the same challenge, but it could be different. And you're able to relate to them personally. That's what saved my life, that I'm here to be talking today, sounding somewhat sensible, because peer support got me back on track when I felt like there was no hope.
Well, and I'm grateful to the peer supporter that gave you hope. Robyn, what would you add to that?
I just want to add that, like, sometimes when people are reaching out for help, some people don't want to go the professional route because they're scared of it. It may be that, like, they want to go, but there's a time frame to wait. Like, unfortunately, sometimes people like, I want something, and it's like, well, we have a couple of months waiting list. I think peer support is one of the things, and as Bart said, that's saved my life too. It was an amazing thing, and I think being able to chat with someone, maybe they have similar experiences, maybe it's a little different, but it's that place of I can sit and chat with no judgment. Some people love a diagnosis, some people it's crushing. So that's something we want to be aware of when we're thinking about it. But that peer support piece for me, in a different way, allows people to be seen, heard, and validated. And I can have a conversation, and I'll say that S word, suicide. Having been someone who's attempted a number of times in the past, super glad I'm still here. I have conversations with people that maybe clinicians won't have about how it might feel, and it's okay to be in a conversation about that. So I encourage peer support. I encourage workplaces to look at peer support programs in their workplace. And I think for me, I'm, as a peer supporter, not going to guide anyone anywhere. I'm going to have a conversation. I'm going to ask how things are working for people and ask them if they want to look at different things, maybe share some things that work for me and say, they may not work for you. There's thousands of different ways to go about this. So that's kind of the place I'd go. Obviously, I'd spend my life talking about peer support. So go peer support.
Thanks, Robyn. Bart, we're going to start with you for this next question. And it's really, and I know you've already done this and we have the video, but if you're talking directly to somebody who's listening now and they're the individual with the mental illness or addiction that maybe they're struggling with and trying to keep their job, what advice do you have for them?
Thank you. Well, I'd like to thank Robyn for reminding me that people are at different places. For me, I was a corporate executive for several years, so I was doing quite well externally and otherwise, but struggling. And it wasn't until I hit 40 that things changed and went through some traumatic experience that also changed things for me. So I suffered in silence for a lot and wouldn't share with a peer supporter or anyone. But it was easier to talk to my doctor, so I spoke to him. But for persons in that situation now, I'd like to plug here a website that's called Checkup from the Neck Up, put together a number of years ago by the Mood Disorder Association of Ontario in partnership with some professionals. So you can do that quietly, fill that out, complete that, and it will give you some information to work with to kind of get you to understand what's going on with you. But more so from the workplace perspective, again, when you're able to partner with your doctor, I found it easier working with my employer if I'm able to present a diagnosis, a prognosis, and a treatment plan. So it helps them now kind of decide, what to do with me, because sometimes because that mental health challenge is not visible as a broken leg, it's like, well, what can we do here to support you? So when you go through that extent of understanding what's going on with you, how does it affect you and what kind of treatment is involved, then you're able to get better accommodation. I suffered for too long, and I'd never want to see anyone doing the same thing. Self-care is very important, and that's at the crux of that. Being able to say, this is what I need, and advocate for what it is that you need until you get it.
That's great, Bart. Thank you very much. Robyn, what would you add to that?
I think the piece for me is I recognise that internal stigma about dealing with our own mental health or addiction is sometimes the piece that stops us from actually saying and being really authentic at work and going, hey, look, I'm having a struggle. Here's the piece for me. I want to be able to get through this. I want to keep my job and be in a conversation with an employer. And, I want to acknowledge there are great employers and there are employers who aren't maybe as supportive as they could be. But one of the things for me is if we could all stand up and say, I'm dealing with this, the world would actually get that it's not 1 in 4, it's probably much, much higher. And I get there's a risk with that, right? But one of the big things for me is about being authentic and saying, I want to work in a workplace that is amazing. And I know there's a next question about that. But I have to take a piece of that too by being vulnerable and saying, hey, I'm struggling a little. I want to stay here. Can we work together to work out how that is? And, that's what I've always done. Truth, I've got my own business now and my boss is horrible, never lets me have a day off. But, I think that's the place, being authentic and real and saying, I think there's something not quite working. Maybe I go to the EAP. Maybe I reach out to peer support. Maybe I go to my doctor. Really quickly, I want to say that I want to be careful about telling employers my diagnosis, my prognosis, and my treatment plan, because not everyone wants to do that. And I hope that employers are in a place where they don't have to know that. Right. If someone wants to share, cool. If someone doesn't want to share and say, look, I'm just struggling with some things here and I want to work out how to stay here, then I hope that employers will go there, because diagnosis, prognosis, treatment plan, for some people, they're not going to want to say that because of the concern about stigma and discriminatory acts that may occur from that.
Yeah. Thanks so much, Robyn. Ray, what would you add to this conversation?
Well, what would you say to a person? I'm that person, in 1984, I was contemplating an easier, softer way out to get out of the trap I was in, and I was facing. And actually, that easier, softer way was suicide. I was desperate, and I really didn't know what was wrong. And here's what happened: I was at a workplace event, a grand round medical teaching rounds, and one of my colleagues did something that no one ever had done that I had seen. He self-disclosed that he was in recovery from addiction. Yeah. And It saved my life. I didn't call him the next day. And when I did call him, I was calling him about a colleague I was concerned about who was drinking a lot and using a lot of drugs. And I didn't fool him for a second. But the point was, I called him, and then he gave me some very rudimentary advice, which of course I followed him. I wanted what he had. He had planted the seed of hope, and it was life-saving. And my problem could have been any of the psychiatric disorders or addiction. The point was, I identified, he's planted hope, and he got me pointed in the right direction so that I could start sorting out what I thought the problems were, and then working out what I thought my solution might be. And everybody's got a different pathway of recovery.
Wow, so powerful, right? The ability to share your story and that it literally saves lives. Thank you so much for that. The next question, and Ray, we're going to start with you for this one, is about when we have an employee who's returning to work, either they've been off with mental illness or addiction, or they're staying at work while they're in recovery. Or what can a workplace practically do that's supportive? And if you need to, tell me some of the things they shouldn't do.
Well, I'd rather stay on the positive, but if they have to start someplace, and it could be with an employee with a problem, it could be somebody returning to work, it could be a human rights tribunal where you are, as the employer, challenged with wrongful dismissal because you fired somebody for having a mental health or an addictive disorder. The point is, there's a rapidly growing body of recognized evidence-based knowledge and skill on recovery-ready workplaces. And in the United States especially, there are many states, Canada's coming along, that have implemented and developed toolboxes or guidelines for all of the things that a workplace can develop. And a core piece of this is the peer recovery champion in the workplace who's self-identified. We know that 9% of the workplace is in recovery from addiction, but because of stigma, they're flying below the radar. Some of their fellow employees and union members know about them. But the other components of a recovery-ready workplace that need to be in place is the biggest one. The reason there's stigma isn't because we use the wrong words. It's because people don't know. They're ignorant. They lack knowledge, and we need to educate people about mental health and addiction. But more importantly, they need to know about recovery, because the news on recovery is exciting. For addiction recovery, 75% of people recover. Other lifestyle diseases like heart disease and type 2 diabetes, as a physician, I never get those kind of outcomes. So it's good news, but we need to get the word out. We need to put decent policies for disability insurance, treat these things as health issues as they are, support people, get everybody on board in the workplace so that all of the stakeholders, and there's a lot, there's top management, there's supervisors, there's a safety committee, there's union, occupational health, EAP, insurers, many stakeholders who need to be on board on what is our message that we're giving to the 25% of our workforce who needs assistance. And when we put all of the components of recovery-ready workplace in place, what we have is a happier, healthier, more productive, more profitable workplace. So it's just good business to do. So, but the short answer to the question is make it a friendly place to come back to that's supportive.
Because a recovery-friendly workplace is very likely going to be a psychologically healthy and safe workplace for everyone. It's just...
the CHIME acronym was developed for mental illness, and it was the evidence-based components that predict recovery from mental illness. We use it now for addiction because it's identical The CHIME, CHIME, is connection, hope, a new identity, meaning in life, and empowerment. And so, yes, exactly the same components work for all of these disorders, all of these conditions.
That's great. Thank you so much for that, Ray. Bart, what can you add to this?
Wow, what do I add to that? It is well presented. Some bits and pieces, and again, I always speak from my experience and all the experience that I've had. And so I found what helped is a return to work plan. So partnering to have a specific return to work plan that's conditioned to what the person might be feeling, creating a workplace culture, a wellness culture in the workplace. So it's not like what I used to hear back in the days when some folks come back to the workplace, they'd be labeled as the walking wounded. Oh, there's that one. You can't do anything but photocopy stuff. Like, really and truly, that shouldn't be the case. So, how do you do that? Well, if you merge mental health and wellness with the Joint Health and Safety Committee and have a joint focus, then there's less other than, and there they go again, the walking wounded. And I think all leaders, it should be mandatory, just like how, again, it depends on the organization. I work for a very large organization that were federally regulated. So there's some rules, like all the leaders needed to have certain training every year. And I think mental health, at least mental health in the workplace, should be one of those things. But ideally, as Robyn plugged it earlier, having a workplace that is very friendly to mental health and wellness, and having peer support champions in the workplace that persons can go to for support. I do some work with MHI, Mental Health Innovation Canada, and they do an amazing job going into the workplace and even medical facilities, putting in peer support programs in there to support people. Because even some of us who work in the medical field or work in the space sometimes needs peer support as well. So again, just to recap, return to work plan. Ensure that Joint Health and Safety Committee also includes mental health and wellness and addiction, and make it a focus so it's not a side, and all leaders should be trained and on at least mental health first aid.
Thanks, Bart. Robyn.
You're welcome.
Well, I think I just want to add a couple of pieces. I was at in Wisconsin recently talking to people with that recovery-ready workplaces, and some of the things they talked about was employees being flexible, like in terms of supporting people to have time off if they had some kind of appointment to go and get their health checked or something. I think for me, there's a piece about sometimes if people are on psych meds, they're a little bit not as, depending on the med, can be a little bit slower in the morning. So can they look at flexible work times? There's pieces about, Ray talked about 75% of people with an addiction recover. It's the same kind of stats in terms of mental health. There was a long study done by Courtney Harding in the 70s and 80s, and they had people who were very unwell, who had been in psych wards for years, come out and followed them for like 30 years, and 75% of people, you would never even know that they had any kind of mental health issue. They weren't on meds. They were living, enjoying their life, doing their thing. So, it's this place about, for me, I don't always talk about recovery anymore, because worldwide people are starting to look at the word wellness instead, or well-being. And I think recovery is such a personal thing. For some people with addiction, it's not using. For some people, it's harm reduction. For others, it's medically assisted. For me, with a mental health issue, I don't use meds, and I work hard, not hard. I work each day to be able to have a great life without it. Some people take medication and it supports them to do really well. So it's that place about being super flexible. For me, adding some mental health days, and that's not just for people returning to work. That's like for anyone. As an Australian, we have 4 to 6 weeks of vacation and 2 weeks sick leave. I came to North America and I went, huh? Like, how do you survive with that? And I hear employers go, oh, but we have to have these people at work. When people are happy in their workplace, they're much more productive. I would rather give someone an extra week and have them work like 10 times harder because they're feeling great at work than keep them at work and have them existing. And that supports their mental health. So I'm just looking, I wrote myself some notes there. I think that one quickie, the chime thing, I think that's for everyone, not just related to people with addiction or mental health. We all want connection. We all want hope. We all want meaning and empowerment. And our identity is, hey, we get to work out what works for us, who we are, how we turn up authentically us. So workplaces, I want to say it's not rocket science. For me, it's about getting our human back on.
That's great. So, Robyn, just continuing with the line of questioning, if we're talking to folks, what do we want to know about optimizing the likelihood of recovery? If right now you're not well with either mental illness or addiction, what's your best advice for optimizing the likelihood of being well-being, as you say?
So I don't know if I have advice per se. I can speak from experiences. I can speak from talking to thousands of people in the last 30 years. And it's that piece of like people having, I think we talked about it really early on, and like a support network. And I think for me, it's thinking, I talk about it as family of choice versus family of origin. And that may be my parents, my brothers, my sisters. It may be my colleagues at work, my partner, like whoever it is, finding someone that we can connect with and feel safe enough to be vulnerable about how it really is. And I think I was at a workshop yesterday and people were talking about when we suppress it and we try and go, no, it's okay, we're going to get through it, it's all right. Like it's kind of, someone described it like grabbing a beach ball and trying to push it down in a pool. And then all of a sudden it goes and it flies out of the pool. And I think for me, if we can just acknowledge things aren't working as well as we want them to, and can we find someone that we trust enough to talk about it, and have someone that's not going to go, you should, you shouldn't, but someone that'll be there to explore the options with us and for us to work out what it is for us. Because even if I've gone through the exact same experience, the way I respond to it might be different. So my piece is being able to find someone I can trust. I can throw out pros and cons of what I want to do and work it out for myself. And actually, it's okay to struggle a little with, I'm not sure, but that's the place where I think the beauty of learning and growing and recovery or wellness, because like my reality is everyone can recover. Everyone can. Sometimes people, for whatever reason, are nervous about doing something like different for themselves or chasing that because they're scared of what people will think. They're scared they might let people down if they get it wrong. And I think it's really important to find people that like have you feel seen, heard, and validated as you go through the experiences that you go through. And I know I didn't say this before. One quick plug. we actually have a course called When You're Not Sure How, and that's for employers about working with people with mental health and addictions or co-workers. My one plug, I got it in. I'll be quiet now.
Thanks, Robyn. Great. What would you add to that? How can we optimize the likelihood of recovery?
First of all, that was great, Robyn, and I agree that. Let me define what I mean when I say recovery from addiction. So recovery only has a little bit about using addictive substances addictively, but there's three other components to recovery. And it goes along, as you say, with its health. It's the World Health Organization's attitude towards health. Health isn't just the absence of disease. The three other components are physical well-being, physical health, mental health. That's one, global health. The third is level of function. If I'm in recovery, I'm functioning at a better level in every area of my life, day-to-day activities, workplace, learning, fun, artistic, whatever. And the final part is pro-social behavior. If I am in good recovery, I'm a better citizen. And that the evidence shows that we're more likely to vote, we're more likely to volunteer, we're more likely to go that extra step and volunteer to be a workplace recovery champion. So that's recovery. Now, recovery doesn't happen. Recovery isn't treatment. Treatment might be necessary for some people to reach remission, which is cessation of the act of disease. But remember, that's only one component of recovery. Then recovery happens afterwards, and recovery isn't something that happens between a professional or a person. Recovery happens in relationships, in communities, and that's a workplace is a big community. Recovery is contagious. Once it starts, the whole community gets on board, and if it's good and healthy, it grows. It's like an epidemic. That's the exciting thing about recovery communities. And now that the workplace is catching on, we can spread that contagion. And the final point I want to make is a statistic. And I don't know the statistic for mental health. I suspect it's similar. But a researcher by the name of Litt identified that the most single important thing you can do to encourage recovery if you have a person with addiction is to really connect them with the person who's in recovery from addiction. If you look at that person with addiction and a year later, their likelihood of being in recovery is 27% higher. There's no modality of treatment we know of, medication, psychotherapy, addictions treatment, that gets that number. So the peer is absolutely everything. Recovery happens in community.
Yeah, it makes so much sense because if I see that you did it, then that's more hope that I can do it too, right? Bart, we know that people are going to want their questions on Slido and they want to come back and ask us, but you get the last 2 minutes to answer this on optimizing the likelihood of recovery.
Fantastic. So, to thine own self be true. That's how I'm going to start out because for 40 years I thought all the things I was doing was right, but they weren't right until I looked inside myself and see that I was not feeling well, I was not functioning well, and I needed to change that. Of course, I didn't listen and then ended up being hospitalized. But coming out of that and starting treatment and being exposed to peer support, I couldn't live anyone else's story but mine. So to optimize my recovery, I need to define what that looked like for me, whether that's putting on my pants and going out 5 days a week or getting out there 5 days a week and doing a job, whatever that is. And so I call that a wellness plan. So I met RAP, Wellness Recovery Action Planning, and it was customized to help me understand myself the way I need to understand myself. And it gave me the ebbs and flow to be able to manage my mental health. So it was similar to the success plans and business plans that I was creating in the business world, but this time it was personalized and customized to me. So my messaging then, once you have a plan, then it helps now if you cuddle and nurture hope, and then start believing that you can get well and stay well for long periods of time. And you can do anything you want with your life, and you can lead a happy and productive life. And when you're feeling down, your supporters will come and cheer you on. And that's optimizing recovery, living in recovery. I've been doing it now for 14 years, living successfully with major depression, severe anxiety, panic attacks. I hear five voices. And I've been doing so well as the CEO now of my own life that, like Robyn, and it's a personal goal, not recommending it, but it's been about 6 or 7 years that I've had to take medication because I get up and I'm on what's going on with Bart and how do Bart optimize his recovery to stay in recovery. That's me. Thank you very much. And again, it was nice being here with all of you good, wonderful people.
Yeah, thank you for that. Do you know there's a theme though that all three of you pick up on, and it's authenticity. We need to be authentic if we're the person dealing with it, to be our authentic selves with somebody. If you're trying to help someone, you need to be authentic in your help. And if you are someone in a workplace, you need to authentically care about somebody's recovery. So we'll go over to the questions now, and we'll see how
Great.
many we can get through.
We
Laura?
have a lot of questions. I am going to go slightly out of order. I just wanted to call out one question that reads as follows. So legally, there's no obligation to reveal your diagnosis. It's sometimes used against employees. So I would like one of the panelists to clarify this. Do we want to speak to that? I think we have talked a little bit, but maybe just to clarify.
I'd highly respect that. That's absolutely correct. If people aren't very comfortable coming out, there's no obligation. There's no and it should be respected as a sacrosanct boundary.
Great.
Right.
Thank you. So we'll go to the top now. So you can read them on the screen, but I'll just read out. How do I get my employer to become more educated about the mental health of their employees?
Okay, so Bart and Ray and Robyn, you all do this work. So can you very quickly give us a little shout out?
All right. Well, Robyn, go ahead. You go first.
That's funny. Like for me, when I always encourage people to just keep talking about, hey, like hearing about mental health, understanding about it, like, and how to support it. I'd love to see us do some training on it. Actually, we are all human beings at home. Maybe we're dealing with family members dealing with it. And it'd be great if we can do some training here at work. So, like, for me, it's just I keep talking about it. And I will say we have that course. So we would love to talk to you more about it. We actually have a game that is an experiential piece of what it feels like to deal with having a mental health issue and the being in that environment and watching workplaces go, oh, actually, we didn't know you were dealing with all of that as well. We can be a bit more productive. So I just think keep talking about it, bringing it up.
Okay. All right,
Awesome.
let's
I'd say partner with the folks that are doing it well and enjoy doing it. So whether that's Robyn or Bart or Hope and me or working through it strategies, I'd say partner with the folks, bring it in. Create a spirit. Back in the corporate life, I used to have Spirit Week ever so often where people get dressed up and do fun things. Now it's Mental Health Week. Ensure that we have a plan every year if you're an employer to bring speakers in to create an environment where at least that education piece starts and the stigma and the self-stigma start breaking down.
Right. Okay. We'll go to the next question. I think what we'll do, because there's so many, is I'll pick one of you to answer and then we'll move forward. So the next one, Laura?
What do you see as the potential advantages and or risks of leadership disclosing their own mental illness or addiction experiences to employees?
So Ray, will you handle that one?
Okay. It depends on the comfort level of the leader. That one of the things in any recovery-ready workplace transformation that has to be is you have to demonstrate buy-in from the top. Not that program is top down. It has to come from the grassroots. It has to have everybody's input. However, if you get buy-in from the top, and especially if you have a leader who's willing to use themselves as an example, a role model of somebody who's actually in recovery, that'll blow. That's a very, very powerful. It's not necessary, and most workplaces won't have that. But if you're going to go public, you have to have thought it out very carefully about what are the costs and the benefits, are the possible consequences. But if you can do it, it's a great advantage.
Next
Great.
one, Laura.
And just before the next question, a lot of people are asking how to get to the various resources that we've referred to today. There is a resource link on your screen at the bottom, so you can link over to many of the resources that we're mentioning today. The next question is about what is the starting point of setting up a peer-to-peer support network within an industry, for example, construction workers?
Robyn, can you take that?
Sure. Like for me, it's about like putting something out to people and saying, hey, we've heard about this peer support thing. We know that sometimes people struggle and don't want to talk about it at work. What do you think? So finding out if people have an interest in it, but you have to provide some information about it. And then, saying to people, hey, we're going to look at doing this. We'd love to hear from people who might want to volunteer. So you want to, we've developed some templates for people about ways to go about it, kind of thinking about, you might want to give employees a little bit of time if they're going to volunteer to do peer support with someone else. So thinking about some of those pieces, developing that, going out to your employees and saying who's interested in doing it. Everywhere I've done it, we've had more people apply than they originally ever thought, doing some training for people and like setting it up like that succinctly.
All of our speakers, their contact information is on that resource list. So if you want to follow up on that, you can. Next question.
Next question is asking for tips on finding a good therapist. It's difficult to search online and find one. Many hits come up.
Ray, do you want to try that one?
I would defer to our peer people, because that's a really good question, especially when it comes to addiction. Not everyone who works with mental health, psychotherapy, or counseling is comfortable dealing with addiction. Not everyone who deals with addiction is comfortable with mental health. And so that's where using a peer to help, where should I go? Or what did you do? Or that really helps make the decision.
Great. Bart, do you want to add to that?
Sure. So that's exactly where I was going to go with it. Connect with a mental health organization like A Hope in Me, the Mood Disorder Association of Ontario. Engage in peer support as a first step, and these are some of the resources that will be discussed as you're going through that process. So MDO, I think we have that resource there, Marianne, that you can probably add to the resource, mdo.org.
Great. Thank you. This next question is one that I hear a lot. Go ahead, Laura.
And we have several questions along this same vein. What should I do to help my alcoholic husband of 38 years to seek and accept that he needs medical help to get well?
Robyn, do you want to try that?
Oh, I don't know if this was one for me. Look, the reality is trying to force people to get that something's wrong with them. For me, it's not about getting people to accept that they're alcoholic or have a mental illness. I think the piece for me is about having conversations about things aren't working as well as they could, right, for all of us. And really want to be able to have a conversation about how can we do something. I'm not going to tell you have to give up drinking or give up drug or do this, but how do we as a couple work out how to have things work as well as they could? And I think if we can come from that versus you need help, I think that might make a difference. That's me. I'd
Beautiful.
love to hear what others have got to say.
Ray, do you want to add to that?
Yeah, if I would say that about 5% of my clinic visits were with people who were in my office trying to fix somebody else. And I had to say, well, who's the patient here? Let's work with who we got in front of us, and let's see what we can do so that your life can be better. And getting them to focus on their own needs is a good starting point. There are lots of peer groups for family members who are successfully managing this question. Not that it ends up necessarily getting the person into treatment, but the person who's presenting, the family member, ends up feeling a lot more comfortable in their own skin. And a side effect is that the family member with the addictive disorder is much, much more likely to get well when they're no longer having someone who's trying to force them into treatment. And then there are therapists who specialize in this in marriage and family therapy, especially with an interest in substance use disorders and mental health recovery.
Yeah, it's tough. People want to fix other people, and we can't do it, but it's hard to hear because it comes from a place of care and concern and love, but there's nothing that we can do until they're ready. Next question, Laura.
And I think we'll end with this last question before we do our wrap up. And the question is, are there any liabilities to team members being providing peer support?
So, Bart, do you want to start that?
Sure, no problem. So I've traveled across Ontario and Nova Scotia, the States, doing all kind of peer support work in organization, etc. And I've never come across this as a liability or peer supporters, being liability. However, there's a good way to do it, and that's why I plugged MHI earlier, Mental Health Innovation, because they have a system to educate the entire organization. And I think either Ray or Robyn referred to the leadership being involved as well. There's a method out there called it See It, Own It, Do It. When everyone's on board, then there's no silos that people are functioning in, and it's part of the culture. So there's some professional ways to do it, but outside of that, I've never experienced anyone having negative side effects from being a peer supporter, which are people who just listen and care.
Yeah, your point though is there's trained and supported and resourced peer supporters, and then there's someone who just wants to help and may end up getting triggered or hurt themselves because they're not trained and supported to do it. Yeah, and that's the kind of training I think, Robyn, that you give as well. And it's so important because we don't want the peer supporters to be harmed.
Right.
Thank
Wonderful.
you. Laura, back to you.
We had so many questions we weren't able to get to, but I hope we got I know we covered a number of the questions that people did ask. So thank you so much to Ray and Robyn and Bart and Marianne, as always, for helping out with the questions. And we'll just wrap up today, and we hope everybody found this helpful. Thank you all for spending time with us. We will, as I mentioned earlier, be making a recording of this session available on the Workplace Strategies for Mental Health YouTube channel in English and French. You can visit the event page for a list of the resources that we've mentioned. And also, we're going to have another event coming up in October. So we will keep you apprised of what that event's going to cover and send out the invite to that as soon as we have it available. So thanks again so much for joining us today.
Laura, can I just interrupt to say Robyn has offered to chat with anybody who has further questions so
Wonderful.
They can get Robyn's contact information.
Yes. Thank you so much, Robyn.